Thank you so much. It's really a pleasure to be here and to share some information about what parents and caregivers should know about suicide. So I want to start with a little bit of a case of a clinical story. Again, this is not about any one individual child or adolescent. It's really a conglomeration, and all names have been changed. So Maddie's story. Maddie's age 12. Maddie used to be happy, a good student, and had friends. About 6 months ago, parents noticed that Maddie's grades were dropping. Maddie was more irritable, more isolative, spending less time with family and friends, much more time in her room. The parents have asked, "How are you? What's wrong?" But Maddie shrugs her shoulders and says, "Nothing, I'm fine." One day they were called by a school counselor. They said Maddie is in their office crying and has talked about injuring themselves, something called non-suicidal self-injury. They took Maddie to Maddie's pediatrician. The pediatrician was concerned, started Maddie on a medication while they and the family were looking for a therapist who might take their insurance and had availability. Unfortunately, one morning, Maddie came to her parents and said that she took a handful of pain relievers last night. She feels sick to her stomach, is nauseous, and is very sorry for what they did. The parents took Maddie to the emergency department where they were waiting for an inpatient psychiatric bed to become available. This story is unfortunately all too common in America, and I really am glad we have the opportunity to talk about it today. This slide, while it may seem busy, talks about how people die in the United States by age. And what I want to draw your attention to is this band in the middle. From age 10 to age 34, suicide is actually the second leading cause of death among children, adolescents, and young adults, exceeding cancer by a great margin. And death by suicide is unfortunately just the tip of the iceberg. Every year, the Center for Disease Control does a study called the Youth Risk Behavior Surveillance Study, and they look at all sorts of behaviors among high school students across the country using a representative sample. These data are available online, so you can check them out yourself, and their most recent results are from 2023. They talk about mental health issues, including suicide. In fact, they say last year, in 2023, among US high school students, 20% seriously considered attempting suicide at least once in the US. 16% of high school students in America made a suicide plan at least once. 9% made a suicide attempt, tried to end their life by suicide at least once. And we really only see those 2% or so who sought medical attention for the suicide attempt, meaning there are vast numbers of America's youth who are struggling with suicide every day in this country, and they need our help. If you think about it, this is not just the pandemic, but it really is the pandemic now, more than 5 years ago, pushing us and our system beyond the breaking point. Evidence of the fact that we're sort of in that beyond breaking point includes the fact that there's greater recognition of mental health care needs for children and families, including in 2021, in a joint statement, the American Academy of Child and Adolescent Psychiatry, ACAP, the American Academy of Pediatrics, AAP, and the Children's Hospital Association, CHA, issued a rare joint statement calling for a national emergency in children's mental health care because the demand far exceeded capacity. In the same year and separately, the US Surgeon General also issued a concern for a mental health crisis that the COVID-19 pandemic had pushed our system beyond its breaking point. While there's greater recognition of the importance of mental health care needs, there's decreasing access to affordable mental health care, exacerbated by the healthcare economics and provider shortages and burnouts. In 2022, in JAMA, there was a report saying that 1 in 5 physicians was intending to leave medical practice. So not just mental health providers, but a great shortage of physicians in the US. And it's not just a physician shortage and physician burnout. This data have also been shown from a large study of nursing, saying that the nursing workforce is shrinking rather than enlarging at a time when we need care most. So what can be done for youth suicide? Well, what can parents and caregivers do? Ideally, there's a lot you can do when you have children or you work with children beforehand to help a child when they have ups and downs of life, including nurturing a solid sense of self, making sure that child knows who they are, that they are loved and respected, and that they can see a future even when life gets rough. It's important to encourage kids to explore the world, to try new interests, to meet new people, to discover who they are. It's also important to regularly make time to talk, to lead by example, to show how you handle your own ups and downs as an adult, and to learn about your child, to be inquisitive. In fact, many studies show that it's really rare for a family to sit down for a meal at least once during the week. When they sit down, they put down their electronics and they talk. I think fewer than 25% of American families do that for an hour or more at least once a week. And this really is an opportunity, if you get in the habit of doing this, to really get to know one another, to build those strong connections, to show emotional health, and also to be aware early on when there are problems. Building resilience. This is talked about so much in our society, and there's no one way to do it. But the idea is you want people, when they're handed lemons, to think about lemonade. If they fall down 5 times, to get up 6, to help them realize that there are lots of options out there, as opposed to it has to be this one way or there's no way I can go on. These are all ways to help kids navigate the ups and downs, and they're important to be part of a kid's upbringing. What else can parents and caregivers do? So you shouldn't wait to talk about substance use. If you wait until you find evidence that your adolescent or your child is engaged in substance use, it's too late. So again, making opportunities to be a role model about how you handle substances and to talk about substances in your regular family context before problems arise is really important. If you see something, say something. All too often, parents may see something in a text or may see something in a letter, or they may hear something from another parent, and they're afraid, well, if I say something, it may make the problem worse for my child. Rarely is that true. So if you see something that's concerning, ask, hey, I wonder what's going on. Don't just yell or get mad. Try to find a way to help your child or adolescent open up and share what's really going on. Don't be afraid to ask. It can be very hard to ask about mental health issues or other challenges. And in the end, you know your child best, so creating an opportunity to ask if you see things that are concerning makes sense. On the other hand, it doesn't make sense to start every conversation asking about suicide or substance use. So context really matters. Preventing tragedies is really important. So by that, I mean safe storage of things that could be lethal if somebody gets extremely upset, violent, or out of control. Again, much easier to prevent access and reduce the likelihood that someone might use something when upset versus to have as much access as possible and then deal with consequences. There are two things that I think safe storage is important for. So one is medications. If you go to your bathroom right now, I bet you'd find a number of medication bottles. They may be old and expired. They may be very large bottles that you get from the wholesale club. Those bottles and those medicines can be really helpful when there are problems. But if there's instant ready access to them, if a child, adolescent, or even an adult gets upset, that means those things that can be life-saving can be used, unfortunately, to take away life. So thinking about making sure that you don't have extra old medications around, making sure if you have large bottles of acetaminophen, otherwise known as Tylenol or ibuprofen, Advil, Motrin, or aspirin, any of those pain-relieving medications, having the medicine is useful, but having it stored in a way that's not readily accessible, potentially in a locked box, so that there's a little bit of distance between someone getting upset and someone having access. That's really important. Same thing with weapons. Not really talking about the merits of having weapons, etc., but having safe storage, having some distance between someone who might be emotionally upset at themselves or others, and access to weapons is really important and can reduce deaths. Advocate. It's not up to healthcare providers, psychiatrists, psychologists, social workers, nurses, just to sort of talk about the needs of children and family in terms of mental health. What we really need are families who are really struggling with these things to tell their elected officials what they need, to tell their healthcare providers what they need, to talk to their employers about what they need. Only by parents talking about what their needs are can we actually improve our system. Other strategies. So we do have a national suicide hotline, or the 988 number. This number is really an incredible resource. It talks about, as you see, suicide is the second leading cause of death for people between, in this case, they're talking about youth 10 to 24, but it actually is between 10 and 34. Sometimes it feels as though your struggle is being underestimated because of your age, but we hear you and help is available. That's what it says on the 988 youth page, which the address is above. So it's not just a number, it's a website, and it provides a lot of really useful information, including how to help. Here you see in terms of how to help, never dismiss what your loved one is saying. Listen with empathy and provide support. Learn the warning signs. Don't keep suicide a secret. If you expand these things, they talk about what are the suicide warning signs that people should be aware of. They include, but are not limited to, if a person is talking about wanting to die or wanting to kill themselves. If the person is talking about feeling hopeless, trapped, having no reason to live, or being in unbearable pain. If the person is talking about feeling like they're a burden to other people. If they start withdrawing or isolating from relationships or activities. If they start showing rage or are talking about seeking revenge. If they have extreme mood swings. If they start acting differently than their usual self, including if they start acting anxious or extremely worried, or agitated or very physically animated. And lastly, if they start having increasing use of substances. All of these may be suicide warning signs, suggesting that it may be useful to ask them, how are you feeling? What's going on? Are you getting support? Is something wrong? Another thing is, how do you ask about suicide? This is actually a picture of something actually called the ASK, or the Ask Suicide Screening Questions. This questionnaire was developed by the National Institute of Mental Health, and it's part of the National Institute of Mental Health NIMH toolkit about suicide. What's nice is, for people who are not accustomed to asking about suicide, it actually is really helpful. It gives 5 extremely useful questions that you as a parent, or you as someone who works with young people might be able to ask. These include, in the past few weeks, have you wished you were dead? In the past few weeks, have you felt that you or your family would be better off if you were dead? In the past week, have you been having thoughts about killing yourself? Have you ever tried to kill yourself? Are you having thoughts of killing yourself right now? And as part of the toolkit, it talks about, depending on the answers, what can a person do? So again, the ask is really useful to help people know how to ask about suicide. Back to the 988 Lifeline, they talk about how do you take care of yourself. Again, this is directly for youth to help them, but it's useful for parents to know. And in terms of taking care of yourself, taking care if you're struggling with thoughts of suicide, you can ask for help. You can make a safety plan. You can help deal with conflicts and pressures, and then you can look for supports, including love, friendship, and respect. If you expand this a little bit and talk about a safety plan, you may not know what a safety plan is, but basically a safety plan is exactly that. It's the idea of being prepared. It's a prioritized list of coping strategies and sources of support that can help you identify what leads to your thoughts of suicide, like what are your triggers. It can also help you figure out what are your ways that you can feel better when you're having these thoughts. The idea is, if you think about this in advance, then you can use it when you're having these thoughts. And the parts of a safety plan are 6 of them. So what are my warning signs? What are the signs that I'm starting not to feel so well, that I'm starting to think about suicide? What are my coping strategies? What can I do? What's accessible that will help me feel better when I'm feeling not good. How can I distract myself? If I'm having these thoughts about wanting to end my life, how can I interrupt those thoughts by thinking about other stuff? My supports. Who are the people in my world who I can reach out to, who I can talk about stuff, who will help me? Who are my professional supports? Who are the people who are part of my care team, who I see as a patient who might be able to help me? And what are my safer environments? How can I put myself in a place so that I won't do something that might end my life, that I might regret? What's also nice about a safety plan is it's not a one and done thing. It's not something one does just when you're struggling with depression and then you put it away, you don't use it. The idea is that as a child or adolescent or even young adult changes as they go through treatment, as they feel better or worse, as they learn about themselves more, they can update their safety plan so it's always there, it's always available, and it's always accurate. Um, this is a concept of a zero suicide plan. And it's sort of the idea of a Swiss cheese model of accidents. Why am I showing this here and talk about suicide? Just like there's no one cause of suicide, there's no one way to prevent or treat suicide. Instead, the idea is you don't want someone falling through the holes of the Swiss cheese. You don't want all the gaps in the system to line up that would allow somebody to fall through to go from having thoughts about suicide to ending their life by suicide. Ideally, to help reduce suicide, we need to have lots of layers of things that don't perfectly overlap so that it catches people along the steps from having those thoughts to actually taking action to ending life by suicide. And those layers include some of the stuff we've already talked about. They talk about sort of screening and assessment and risk formulation. They talk about a collaborative safety plan, which we just reviewed. Also, you want to have treatment for suicidal thoughts and behaviors and related mental health conditions. And then you don't want people to fall between the gaps in our healthcare system. You want them to have follow-up and to have relationships, both professional and personal, that can help them with stuff. That's the idea of a zero suicide plan, is lots of layers that don't overlap so nobody falls through. Here's another part of the Oregon Zero Suicide Plan that talks about how can we help people at the individual level, at the relationship level, at the community level, and the societal level. And I'm not going to go through all this right now, but just to sort of talk about some of these things. At the individual level, we want to help people with mental illness and substance use. We want to be aware if they've had a prior suicide attempt. And we also want to be aware if they're having increases in impulsivity or aggressiveness, because all these at the individual level are things that hopefully we can do something about by helping the individual gain more coping and problem-solving skills, gaining access to treatment and other community resources, and by asking questions about how they're feeling to help them navigate needs for more care. At the relationship level, things to highlight include bullying or other violent relationships, as well as a family history of suicide or a lack of supports or relationships. And ways to intervene are to help improve people's connectedness, something that's more important than ever, I think, during the pandemic and the past 5 years, to help people feel connected to other people for support. At the community level, this is again where finding ways for people to connect with their community, not just in their family, but across their neighborhood and other areas, is very important. Yet stigma often gets in the way of people reaching out for that kind of support, or other societal barriers that prevent people from connecting. And then lastly, at the societal level, again, this is something that we really need people to advocate for to improve our healthcare system, to reduce and address stigma in our society for mental health issues. And together we can make a powerful difference. So just to sort of wrap up, we've talked about how suicide, both ideation, meaning thinking about it, planning, and death by suicide, is all too common for youth in America. Parents and caregivers, though, have a really important role in preventing, detecting, and treating youth suicide. There's no single solution. Rather, we need overlapping strategies so no one falls through the holes in the Swiss cheese. Prevention. It's really important from earliest days to help nurture a curious, resilient child with a strong sense of self. Also, harm reduction, placing barriers between the urge to end one's life and means, including medication and weapons. Detection. It's important to create regular time to talk as a family, to share your ups and downs. And if you see something, say something. Don't just hold on to that worried that when you approach somebody with curiosity about what's going on or how can you help, that may make it worse. Advocacy. Together, again, we can make a powerful difference for more accessible treatment and more research about why people struggle with suicide and how we can do a better job detecting, treating, and preventing that in children, adolescents, and young adults. Thank you so much. It's really been a pleasure to be part of today's webinar, and I hope you found it useful.